Can type 2 diabetes patient have total knee replacement? The answer is absolutely yes. Type 2 diabetes is the commonest diabetes seen in adult population. And type 2 diabetes patients generally have high chances of developing osteoarthritis of knee, and these patients will require knee replacements at some point in their life. The precautions which need to be taken for a type 2 diabetes patient before knee replacement are: number 1, complete and total control of diabetes. Number 2, identification of septic foci is very important. Number 3, during and after the knee replacement surgery, it is very imperative that sugar levels are monitored and maintained at a proper level. Number 4, any sepsis anywhere in the body has to be treated before, during and after the surgery. Number 5 is these patients have to be very careful throughout their life because there is an implant inside and chances of developing infection with hematogenous route are also there. So yes, knee replacement surgery can be done in type 2 diabetes patient with proper care and a proper surgical technique. Thank you.